Talking about a potentially life-threatening condition called aortic dissection. Joining us now is Dr. Alexander Kulik of Boca Raton Regional Hospital to tell us more. Dr. Kulik, thank you so much for joining us. Let's start with the basics. For those who don't know, what exactly is the aorta?
Well, thanks very much for having me. The aorta is the major blood vessel in the body. I like to think of it as the major highway with many off-ramps. With each heartbeat, the heart pumps into the aorta, giving blood supply to the brain, the arms, the legs, and the belly.
Okay, then what is an aortic dissection?
Well, an aortic dissection is caused by a tear in the inner lining of the aorta. This leads to considerable chest pain and back pain. It can lead to the accumulation of blood around the heart, and it can lead to blockage of some of the branches of the aorta going to the brain, the arms, or the legs.
And there are two types, type A and type B, right? What is the difference?
Well, the type A aortic dissection requires emergency surgery because it can cause blood accumulation around the sac, in the sac around the heart, and this could be a fatal condition. If the first part of the aorta is not affected, that's what we call a type B aortic dissection, and sometimes surgery is not required for this type of condition and can be treated with medications at times.
Now, chest pain is one of the symptoms. What are the other symptoms, and how can you tell the difference between an aortic dissection and a heart attack?
Well, a heart attack usually causes chest pain where a patient describes it as heaviness or tightness in the chest. It can radiate to the arms, the shoulders, and the neck. With an aortic dissection, usually the pain is sharp or tearing in quality. It can be in the chest and go to the back. And if there's a blockage in one of the arteries coming off of the aorta, other symptoms can be present as well. Stroke, arm pain, leg pain, even paralysis.
Are there any risk factors?
The most important risk factor for aortic dissection is high blood pressure. That seems to predispose to an aortic dissection condition. The other most important risk factor would be a connective tissue disorder. That's an inherited weakness in the major blood vessels in the body, the most common of which is Marfan syndrome.
And what types of treatment is available?
Well, if the aortic dissection involves the first portion of the aorta, what we call a type A dissection, that requires emergency open heart surgery. And during that operation, we take out the torn portion of the aorta and place a new synthetic tube to replace the aorta. If the dissection involves the latter portions of the aorta, in the past we used to do open chest operations, but now oftentimes it can be treated with a stent, which is threaded through a small cut in the groin in the femoral artery.
Okay, we had a viewer write in and ask, how will having an aortic dissection affect my daily life after I have received treatment?
Well, once a patient is diagnosed with an aortic dissection, they may require surgical repair. They need close observation for their blood pressure in the weeks and months that follow. And oftentimes other areas of the aorta can grow in size, or complications can develop in other areas of the body after a dissection is diagnosed. So careful follow-up is necessary with physicians, in particular with CAT scans done every 6 to 12 months to evaluate the aorta over time.
Okay, Dr. Kulik, thank you very much for joining us. Boca Raton Regional Hospital sponsors our expert and underwrites Ask the Doctor.